You are live, Commissioner. The floor is yours. You are live, Commissioner. The floor is yours.
Wendy.
Good evening, Douglas County, and thank you for joining us. My name is Wendy Caudle, and I'm part of the External Affairs team at the county. May is Mental Health Awareness Month, and tonight we are pleased to keep the conversation going by bringing you the 7th Annual Mental Health Forum hosted by Vice Chair and Commissioner of the 2nd District, Kelly Robinson. To open the program, we have a brief video on mental health to share with you.
Depression and anxiety. Those aren't bad words, but for some people, they do not want to admit that those are emotions they are feeling.
There's still that stigma of mental health. There's still that stigma of there isn't anything wrong with me. I don't have any symptoms.
Mental health experts say because of the pandemic, adults and children experienced an increase in behavioral health related issues.
COVID exacerbated a lot of it. I'm a single mother and I lost my job. I'm in between places right now. I'm not stable. All of those things can lead to behavioral health or mental health breakdown.
Due to isolation during the pandemic, many were unable to see their loved ones in person, which caused them to worry. And that silent worry and concern can cause a ripple effect.
Not dealing with it can cause a strain in your relationships. It can cause a strain in your family. Sometimes it can cause your family to want to disassociate themselves from you.
Sadness is not the only sign. Anger and frustration can also increase during a mental health crisis.
A teacher or even a principal may not pick up on this is a mental health issue. So what they see as a behavior issue is really a mental health symptom. So a lot of times it can go untreated.
The Douglas County Community Service Board treats thousands of residents a year through a variety of programs. Most clients started off as walk-ins.
We have family therapies, we have psychosocial rehabilitation courses, we have parenting classes, substance abuse disorder classes and groups. It's a huge gambit.
Therapy and medication, when needed, are key, but so is reducing the stigma in order for people to not be afraid to get help.
Until we understand mental health is normal and everyone deals with mental health, we all have some type of mental health symptoms. Until, as a society, we understand that, mental health will always be a growing stigma.
Thank you, Communications, for that. And a lot of great information just in that brief video alone. It's a little appetizer for what we're going to be talking about this evening. And speaking of this evening, I think it's time to meet our host. I'd like to introduce Vice Chair and District 2 Commissioner Kelly Robinson. He was first elected in 2008 and is completing his 4th and final 4-year term in 2024. Historically, Commissioner Robinson has focused his oversight duties to the county in 3 areas, which are finance, economic development, and transportation, serving as committee chair of all 3. In addition, Robinson is a certified part-time instructor and has taught entrepreneurship, business analysis, and strategic management at the J. Mac Robinson College of Business at Georgia State University, where he also earned a Bachelor of Business Administration and Master's in Management. With personal testimony and understanding, Commissioner Robinson was a key force in the introduction of mental health services in the form of prevention and intervention through continual appropriation and expanded access to services through our Community Services Board, increasing their annual budget by approximately 30%. He also fulfills mental health awareness by hosting an annual forum, this is his 7th, in 2022, to increase awareness. Robinson has consistently believed that Douglas County's future quality of life can only be increased with a focus on economic development involving innovation, industry, and investment, as well as housing policy. Robinson writes and publishes policy papers on various housing and financial topics that extend solutions toward national issues. In addition to being a member of Word of Faith Church and serving on the Bronner Brothers Institute Foundations Board, he is the proud father of two sons, Kelly, 24, and Christopher, 22, his priest and king, respectively. I'd like to introduce the Honorable Kelly Robinson.
Thank you so much, Wendy. Thank you very much. Welcome, Douglas County. Hi, I am Kelly Robinson, and we're going to get right to this. As was suggested, everybody has issues. Nobody's exempt. There's nothing that we patronize. We understand it. That it's easy to talk about. Now, I'm legally blind. It's easier for me to talk about my eyes because it's physical. Your arm may be broke. But the mind is a fragile thing. And how do we as society deal with that and talk about it? Deal with the fear, deal with the angst, deal with the things that we know that we need to address. When can we as a nation, as a society, begin to ascend in such a way that it's just as good to talk about, I'm going through bipolar, or I've got this depression going on, just like oh man, I've got a cyst, or I got this going on, or something else is happening in our lives. So it's a conversation, and it's something that is not going to happen overnight, but we've got to be open to evolve, because the mind is a terrible thing to waste, but it's something that also needs to be maintained. So I look forward to the conversation today. Again, for those who have never been to Douglas County, we are roughly 146,000 people strong. We're very proud. We're very diverse, very enriched as it relates to our culture here. We got 4 character areas that are very unique and different. And I will not get into that right now, but I do want to share some statistics that if you think about Douglas County, we believe that everybody is equal. All voices are matter. But at the same point, we know there's equity in the sharing of resources. And we're going to talk about that a little bit later about equity, right? Some people need this amount, somebody needs a little bit more. We're going to get further into that. With that being said, I want to make sure I acknowledge my fellow Board of Commissioners, because again, without them, without their 5-0 support unanimously over all these years regarding this matter of mental health, this could not be done. So let me start with, obviously I'm going to come to the chair last, but District 1 Commissioner Henry Mitchell III, out of the 1st District, thank you. Commissioner Dorinda Carthen out of the 3rd District, thank you. And Ann Jones-Geyer, Commissioner of the 4th District, thank you all for your support as my district fellow commissioners. Finally, Madam Chair, I'm going to come to you as a formal introduction, but thank you, ma'am. Of course, without your support, we cannot get this done. With that being said, let's get right into this, Wendy. So we've got a keynote that we're going to go ahead and tee up our very first speaker. And if you go ahead and do the bio, Wendy, we'll just get this going. Dr. Harris. Mm-hmm.
Yes, I'd love to introduce you to Dr. Patrice Harris. Dr. Patrice Harris is a board-certified psychiatrist from Atlanta. She has executed a number of accomplishments as a private practicing physician, public health administrator, patient advocate, and medical society lobbyist. Dr. Harris has held many leadership roles throughout the state of Georgia, as well as the nation. She served on the board and as president of the Georgia Psychiatric Physicians Association, the Medical Association of Georgia's Council on Legislation, its Committee on Constitution and Bylaws, its membership task force, as well as the nation's American Psychiatric Association. Dr. Harris was elected to the American Medical Association Board of Trustees in June of 2011, voted in as secretary from 2014 to 2015, and served as chair from 2016 to 2017. From 2019 to 2020, Dr. Harris served as the 174th president and first African-American female president of the American Medical Association. A governing theme that consistently guides Dr. Harris's professional life choices is a passion to improve the lives of children and service to others. Ladies and gentlemen, Dr. Patrice Harris.
Well, thank you, Wendy, for that very kind and generous introduction. And thank you, Vice Chair, for hosting us tonight. And certainly it is an honor and a privilege to be on with my fellow panelists, as a psychiatrist, I never turn down the opportunity when I can to talk about mental health. And I am always sort of partial to talking about mental health in my home region. I came to Atlanta in 1992 to do my residency and fellowship training. And certainly, though I've had the honor and privilege to travel nationally and internationally, I do love our region here and always want to do what I can to improve the lives of those who live in our region. And as the video showed, COVID-19 certainly amplified a lot of issues, right? It amplified health inequities in general. It amplified the lack of a public health infrastructure. It amplified the lack of a mental health infrastructure. Certainly the combination of all of those. And so tonight we are focused on mental health, but I have to say, we can use this moment. We can use the moment that we have where it's been amplified. But as everyone is aware, these are not new issues, right? I look back in 2001, the Surgeon General at the time published a Surgeon General's report on mental health, race, and ethnicity. He had previously published a report on mental health in general. That may not seem groundbreaking, but it really was, because I think we should all admit that it's been difficult to talk about mental health in general. It's improving, thank goodness. But at the time, people didn't want to talk about mental health. And so here we are with an opportunity, not just to talk about it, because we know the issues, right? We know the increasing rates of suicide attempts and suicide, particularly in young Black men. We know the increased rates of depression and anxiety. And we know that COVID has, again, exacerbated pre-existing conditions. So the key issue is, how should we think about it going forward? What are we going to do about it? And so I'm going to show just 4 slides, just take a few moments to talk about a framework that I like to use when talking about mental health. So I'm going to share my screen, and if someone will let me know when they see my screen.
We can see it.
Very good. So again, these health disparities and their impact on all of our communities are long-standing. But I like to start with not a deficit approach, but a strengths-based approach. What creates health in the first place? And I think if we think about a framework for what creates health, we can then think about solving for what is detracting from health. And we all know, we've talked about the social inequities. I will say, and I haven't come up with the right term, I'd love for us to come up with another term beyond the social determinants of health. Because sometimes when people hear the word social, they think not my problem to solve, right? It is all of our problem to solve, and we can talk about more. We know that there are political determinants of health. There are individual determinants of health, community determinants of health, and it is where you live, work, and play. That's not new information. It's whether or not you have health insurance. We know people without health insurance live sicker and die younger. And we know, particularly in our region here in the Southeast, communities of color are more likely to live without health insurance. And so I think it's critical that we have conversations about expanding Medicaid. When we think about access to care for mental health and substance use disorders, we know that Medicaid accounted for an increase in so many people being able to finally access services. But again, it's the built environment, whether or not you have well-lit sidewalks so you can walk. It should not require an expensive gym, but it does require an appropriate and safe built environment. We know that education is linked to health in general, particularly mental health. We know that laws and regulations, we all know the history of redlining, discriminatory lending policies, all of these are detractors from health. But if we solve for some of these issues, we can certainly create healthier communities. And if we look at these, it can seem overwhelming, but I like to think about upstream, midstream, and downstream. And yes, it is all of our problems to solve, but we each, from an individual level, government level, public-private partnerships, have a role to play. We can look at what we can do for safe neighborhoods, whether or not people live in food deserts, whether or not there's access to care, health insurance, as I mentioned earlier, housing, it is critical. And so all of these give us opportunities to do something at the societal level, at the community level, and certainly at the individual and family level. I will say, and something we think about with mental health, we must do all that we can to prevent people from shaming and blaming, as I say, and talking about these issues, just like diabetes. Diabetes is a chronic illness. There's treatment available, not a cure. And we should think of these disorders, bipolar disorder, depression, in the same way. But it's so important to meet people where they are. And I think going forward, we have to think about that as we think about designing and building a mental health system and thinking about services in schools close to where people need them in communities. You know, I can say, and I'm a member of the health profession, that we oftentimes want people to come to us. We need to make sure we go to people. We need to think about our own implicit biases that detract from giving the best care. We need to think about and require culturally responsive care. So those of you in government and policy who are thinking about this, think about making sure that where you put your money, providers must demonstrate that they are providing culturally responsive care, because we know that so many people from communities of color don't find providers, health professionals who provide culturally responsive care. We also have to think about the evidence. You know, it's not enough just to hang out a shingle and say, I think I can do this. People need to be trained and need to be providing quality evidence-based care. My last two slides I'll just show, I'm sure people have seen some form of this slide. You know, equality is giving everyone the same thing, but it really isn't meeting individual needs. Equity is where we need to go, giving people what they need on an individual level. But we also know that reality is that some folks are giving advantages that others don't have. And really, we want to get to a place where there is justice. And again, COVID has highlighted a lot of issues and the interconnected issues. And one issue, and I just want to end with this, is we have to have comfortable conversations in the healthcare community, but across our society. We have to name issues, and we have to name racism and structural racism and all of these issues. And I like this definition, so I'll leave you with that, because again, some people are uncomfortable talking about these issues. And so I like to say, let's start with a shared definition so we all know that we're singing from the same sheet of music. And this is about structuring opportunity and assigning value that unfairly disadvantages some and advantages other. And APA past president, she's now faculty at Morehouse, Dr. Kamara Jones, has talked about this. And so here's where we need to go as we talk about mental health. There is no shame in seeking help. As Vice Chair said, all of us go through depressed mood, anxiety. It may not be a disorder, and we should try to get away from those pressures to be who we are not. And I'll just say these as I end, particularly in communities of color, the myth of the strong Black woman. And so if I ask for help, I'm weak, I didn't pray hard enough. And of course that men, Vice Chair mentioned men can ask for help. So these are all the conversations that we need to have. We need to talk about trauma in our community if we really want to get on the other side of this and truly develop a mental health system that meets the needs of everyone. So thank you for the opportunity this evening. I look forward to the questions.
Thank you so much, Dr. Harris. Very, very, very poignant. Excellent framework. And you talked about the variables that impact us: housing, education, food, that all weigh in on sort of our mental health. Obviously, it's something, education, which will stay in our lane regarding that, our programming, obviously the impact from social media, etc. So, Doctor, before I introduce Madam Chair for the first question, so let me make sure I get this right. So there's 19 million people in America that have some type of anxiety. If I recall, there's something about 6 million people who have depression. There is 3 million people that have schizophrenia, and there's roughly about 2.5 million bipolar. Do you see, and again, this is, you don't have to answer this in this context, but these numbers suggest that it's increasing, and that the pandemic had a way of exasperating, per se, not necessarily creating new. But I'm interested during the questions if you'll address those for me. With that being said, allow me, Douglas County, to introduce our chair, Dr. Ramona Jackson Jones. She is in her second term as the county's chair, the first African-American woman ever in our history of 150 years. She has 40 years of healthcare experience. She is a veteran. She has just recently been named one of the 100 most influential women in Georgia based on Engineering Magazine and the Fred Agar Governance of Public Health Award winner. Madam Chair, please, with all respect and due, please, you have the first question. Welcome.
Thank you so much, Vice Chair. And thank you, Dr. Patrice Harris. Thank you for being here tonight with us, and welcome to our esteemed panel. First and foremost, Dr. Harris and our esteemed panel, I would like to thank you for your incredible collaboration tonight with problem solving and addressing mental health inefficiencies in Douglas County and Georgia at large. Dr. Harris, thank you for your incredible energy and tenacity for leading the charge to advance mental health in Georgia and across the nation. With that being said, Dr. Harris, according to research, the mental health crisis in America officially started in 1963, which was 59 years ago, when the Kennedy administration implemented the Community Mental Health Act, referred to as deinstitutionalization. That's a big word on me, and I know you've heard of it. With that being said, the call to action and solutions-based measures to address mental health has largely lagged behind for almost 6 decades, which has resulted in a staggering number of over 27 million adults in the United States who are going untreated at this time. Dr. Harris, please share your thoughts regarding the federal government's broader approach and the possibility of forthcoming legislation which will address specific mental health resource needs, such as reinstating mental health facilities and improving availability and access to mitigate the current mental health crisis as a call of action to reduce the number of adults being untreated. And of course, a treatment plan is badly needed for our youth as well. So if you could elaborate, I would greatly appreciate it.
Yes, and I'm glad you mentioned that, going back to President John F. Kennedy with the Community Mental Health Center Act. And it was a great idea because at the time we saw so many folks with mental disorders who were languishing in institutions, right? And so we certainly wanted to get them out of institutions. But we were supposed to, as a nation, make sure there was adequate funding for services in the community. Now, I won't say how old I am, but I was a little girl back then. But I can tell you we didn't then, and we have not since. And we've gone in the wrong direction for making sure there are community services. The other thing I would say, and we do this typically in our country, right? We swing from one extreme to the other. So clearly those institutions that people were in were horrible, right? Most of them did not offer any services. Many of them were unsanitary. However, we still need today a comprehensive continuum of services, right? And I know you all know this, those of you who are leaders in Douglas County. You've seen your county jail medication budget and mental health budget go up. Counties across the country experience the same thing. And that's because over the years, again, instead of funding services in the community and funding a full continuum of services, certainly there are times when some of my patients need to be in the hospital. We just don't have those services. So we need that full continuum of care. Now, we all know that President Jimmy Carter also had a focus on mental health. And so there was some attention, but again, not enough funding. I think the good news is President Biden, in his State of the Union address, specifically called out mental health and specifically talked about the budget needs. And now Congress has to fund that. Now, we'll say it's, to me, for the most part, been a bipartisan issue regarding the need, but we'll see if there's a commitment for the funding. And we do need a lot of money. You know, I am not a believer that throwing dollars at a problem solves everything, but sometimes throwing dollars at a problem is needed. And so we clearly need that federal response. But again, there's good news. President Biden elevated this in the State of the Union address. The current Surgeon General put out an advisory, youth mental health advisory, as you mentioned. As a child psychiatrist, I'm quite concerned about that, and we certainly need more services there. And the last thing I'll say is what's coming online in July is 988. Of course, that will need to be funded, but that will be the new number to call when there's a mental health crisis. We've seen the horror stories of when 911 is called, and we need to make sure that when first responders come to a crisis, that there are folks trained in mental health to deal. It's not the same as you might for other, when there's crimes going on and so forth and so on. And so I'm optimistic about 988, but if it doesn't have adequate funding, it won't be what we really need.
Great. Thank you, Dr. Harris, for the response. Thank you, Madam Chair, for your inquiry and your question. And again, there's 988 to staff, make a note of that so we can stay close to that, because there is alignment both at the federal, state, and local levels that needs to occur. We're going to keep this conversation going, and I appreciate that. Wendy, let's go ahead and give this a question that we know that came up. Wendy?
Yes, Dr. Harris, I really enjoyed how you were talking about all the different elements that make up health equity, and how we haven't reached it. There's social elements, there are financial elements, there are education elements, and I think we have to really do an all-out assault, come at it from every angle to solve these really big issues. So one of the angles, when I was researching about you and about this, one of the things that the American Medical Association has done was establish the Behavioral Health Institute Collaborative, which has partnered with 7 other medical associations to help overcome obstacles to integrating mental and behavioral health into primary care practices. So I was hoping you could tell us more about this and why it's such an important initiative. Oh, you're on mute, Dr. Harris.
Thank you. Yes. And I'll say a couple things. I'll start with the local level, though. And when I was county public health director, and I would go out and the commissioners would have a forum in all the districts across Fulton County, one issue that came up constantly, no matter the topic, even if the night was going to be focused on transportation, the community always raised the issue of mental health. And that's what happened at national forums for the AMA. Our team would go out and they were talking about payment reform and delivery reform and whatever we were talking about with the AMA. And we have a wide and deep portfolio. Mental health kept bubbling up. Now, I have to tell you that one of the things I'm very proud of, and my association is proud of, is that people saw me as a psychiatrist as president of the AMA. Because I can tell you, years ago, people would say, I don't want to see a psychiatrist. They're not real doctors. Or I don't want to see a psychiatrist. I'm not crazy. So that was a part of the privilege of being the president of the AMA, is sort of demonstrating that mental health care and psychiatry is a part of overall health care and medicine. So it just kept coming up. And so we at the AMA said, well, we can't just ignore this. It comes up, and let's figure out what we can do. Now, we know there's a workforce shortage. There's not enough of me. There's not enough psychiatric nurses, counselors. And so that's another problem that we have to solve. But we know that so many people go to their primary care, those who have primary care physicians, and my primary care colleagues see a lot of folks who have depression and anxiety and other issues. And so we thought it was a good idea to really hone in on the opportunities for training and working with primary care colleagues to educate them on this sort of what we call integrated care. Because again, not going to solve this, there's just not enough of me. And there's not going to be enough of me, meaning child psychiatrists and social workers and psychologists. We have to commit to that, but that's a longer term solution. And so this project around integrating behavioral health and primary care was born. And that's where that work came from. And I do want to say, because I know we'll be one of as state representative going to talk about parity in the state legislation. And let me say what an important piece of legislation that is. Parity or the lack thereof is still a problem. Very frustrating. People don't realize this until they get in a crisis and they realize that they don't have the same level of care that they would if they had had a heart attack. And insurers and payers don't pay the same, don't have benefits that are the same. And so parity legislation is so critical. And when we would talk to state insurance commissioners, they would say, well, no, none of the constituents in state X is calling for this. They haven't raised this issue. And that was because most people didn't know that there was federal legislation signed into law by George W. Bush. And some states have passed legislation. So again, I want to congratulate a state representative. And it was a good thing that Georgia passed the parity laws. Now, as everyone in this room knows, the laws is the first step. Well, there has to be accountability and enforcement of that law.
Thank you so much for that response, Dr. Harris. We got one more question, but I'm going to make this statement to your point. Coming in 2008, the very first thing we, as a county in proper, is we funded the creation of a law enforcement and detention center code for jail. And it was 3 times bigger than what we probably would have needed. And we chose to put money into hard assets versus programming, which is sometimes providing of services. And it wasn't until 2015, so from the class, I'm the class of 84, so the class of 85 to 2015, a 30-year policy ran. I'm in a conference and I'm listening to the keynotes, and it's like, you heard them at the state say, oh God, they're about to start building accountability, of course, in 2015. So it took 30 years of a policy for to realizing that. And the reason they did it, it wasn't for some type of moral enlightenment. It was the cost. That our jails have now become mental health wards. And I'm sure sort of alluded to that, and I'm sure state rep will deal with this. And so we recognize that we've got some work to do. We've got some latent policies that are not only just the natural variables you're talking about, we have some institutional things, some systemic things that is also keeping things going as is. So duly noted on that. So Wendy, we want to give the Dr. Harris one more question. Give her a good one, please.
Yeah, it's a simple sounding question, but it's probably one of the hardest things to overcome. It's why we're having this forum. Dr. Harris, what can we do to help dismantle misconceptions on mental and behavioral health? Everyday people, what can we do?
Yes, well, first of all, there's so much misinformation and disinformation out there. We've seen that with COVID, and we see that with mental health, and we saw this, of course, pre-COVID. For instance, I had so many people say to me, and by the way, unfortunately, this has been prevalent in the Black community and let me just share, I always share this story. This was years ago, so fortunately we've moved away, but I do want to share this story because I think unfortunately it still exists. But I went to church one Sunday, and the pastor said, and listen, I know that there was a point, but it said, if you have God in your life, you won't need your psychiatrist, right? And I remember thinking, You know, I never hear pastors say, if you have God in your life, you don't need your endocrinologist, right? Your doctor to help you with your diabetes, or your cardiologist. So I think, you know, for many years it's been maybe people are possessed by demons. And let me just say, listen, so there's a wide spectrum from somebody who may be experiencing time limited anxiety to some of my patients who do hallucinate and are delusional. These are all brain disorders. There's chemical imbalances, but for most people, I can know that it may look frightening, but these are medical disorders, and we just need to make sure that we are, So first of all, I say start with, you said, what can the individual do? Start at home. Make sure you have accurate information, that you're watching your language when you talk about people. And I try not to use the term crazy. Try not to use the term addict. Try not to use some of these stigmatizing language. Find websites that are reputable and credible. Again, we know there's so much misinformation, and share that information. If you see someone struggling, no blaming, no shaming, just say, listen, observe, state your observation. I'm seeing you this. Are you struggling? Can I help you? Be someone's partner. And then if you want to go broader, be an advocate, right? Make sure, be the person that says, we need to make sure there's money for our community mental health system. We need to make sure everyone has at least an opportunity to get insurance. We need to make sure these parity laws are enforced. So you can go from the individual, making sure you have adequate knowledge. The last thing too is no one should be ashamed to seek help. There is no shame in seeking help. And I'll just share another personal story. All of us were overwhelmed and have been overwhelmed with COVID. Added to that, the trauma, I can tell you that we all saw what happened with Mr. George Floyd. Here in Georgia, we had Mr. Ahmaud Arbery, and I will tell you that was a day that I felt I was at my breaking point that day of feeling unsafe. But you know what? I have a lot of privilege in my life, right? As a physician, and I could afford to pay my bills, and I could afford to go to the grocery store and order in. And I remember calling some of my colleagues that make sure our frontline staff is taken care of, because this is COVID, the racial injustice, a divided political discourse. It's very anxiety provoking and traumatizing. So I will say at the very end, all of us should give ourselves the grace and the space to feel how we are feeling. And when we need help, feel free to ask for help. And then those of us professionals on this call, legislators, we should do all that we can to make sure that there's a system that's welcoming, so that when people ask for help, there's a system that is available to provide that help.
Dr. Harris, thank you so much for that response. Thank you very much for your care and your kindness, your contribution to today's conversation. Is there anything else you want to say in goodbye? We want to shift to our next panelist, but we just have to we thank you, because you cared enough to just take time off for Douglas County.
Well, thank you for the opportunity. And I will just say we are just beginning, right? And I know it's exhausting, and I've given you, and I'm sure my panelists are going to give you several things on our to-do list, and it can seem overwhelming, but together I think we can make movement. And I, again, just appreciate the opportunity to be with you tonight.
Thank you so much, madam. Have a good evening. Thank you so much, doctor.
Thank you.
Right, Wendy, next up, we're going to bring up our own Georgia State Representative Kimberly Alexander. If you have the honors, Wendy.
For the past 10 years, State Representative Kimberly Alexander has served in the Georgia General Assembly on behalf of District 66, encompassing Douglas County and the southeast section of Paulding County. She has solidified her placement in history as the first African-American female elected in Paulding County, as well as the first African-American female residing in Douglas to be elected to serve Douglas in such capacity. Representative Alexander has utilized both her long-standing commitment to community services and her public reputation as an impactful official to acknowledge, support, and enhance mental health awareness in the state of Georgia. In 2016, she sponsored H.R. 1093, House Study Committee on Mental Illness in the effort to remedy housing issues for the mentally ill. Upon the study committee's passing in the House, Speaker Ralston appointed Representative Alexander its vice chair. In 2018, Representative Alexander sponsored HB 733 to add psychiatrists to the Loan Repayment and Fellowship Program for underserved locations, an effort that helped to materialize the inclusion of psychiatrists in the $1.9 million allocated in the fiscal year 19 state budget for medical doctors in rural areas. Madam Rep, the floor is yours.
Thank you, guys. I want to say thank you to Commissioner Kelly Robinson, 7th Annual Douglas County Mental Health. So thank you for always going this extra mile to have this important forum every year. Thank you to the commissioners that support you. Thank you to our commissioner chair. Very important issue, and thank you for being in the forefront of that, Commissioner Robertson. I want to talk to you about HB 1013. This year, even though every year we come back and we have some legislation on mental health, this was the year for mental health to get passed. And when I tell you what is in the budget, the amount of money that is being allocated, I think all of you would be proud. And even though we allocate the money, it is still so much that needs to be done with the mental health. But so people will understand about HB 1013, which is the mental health parity. That bill was 76 pages. It has 7 sections of it. It was a bipartisan bill. I know you guys hear that sometime, and then it's like one Dem and about 5 Republicans on there, but this was actually across the board. Everybody in the House and Senate voted for this bill because everybody have been looking at what has been occurring since the pandemic with mental illness and high skyrocket. Suicide has skyrocketed, domestic violence, child abuse. I mean, it's so much. And so everyone, I believe the whole 180 in the House are thinking in terms of what can we do to help. I mean, I know that's what I've always thought about. What can I do to help with mental health? So just to give you some background about HB 13. So the federal government in 2008 enacted a law that aimed to require parity, meaning insurance companies were to cover mental health care the same way they do for physical health care. Seems quite simple, right? Well, the data has been collected in Georgia to determine whether or not this is happening. And of course, it was not happening. There's no evidence to show. There is no data on this. And so this measure is the result of recommendations from the Georgia Behavioral Health Reform and Innovation Commission. I would encourage everyone to read that, which developed more than 50 suggestions to change Georgia's laws. Georgia ranks low nationality on most measurements of mental health treatment and high in the percentage of residents who face challenges. According to a 2021 report by Mental Health America, a century-old nonprofit advocacy group. And so what does 1013 do? It expands Georgians' access to mental health care, increase the number of mental health professionals in the state, require insurance companies to cover mental health the same way they cover physical health. It seeks to increase the number of mental health professionals, which is what we all want in Georgia, and improve mental health data and transparency. The American Academy of Child and Adolescent Psychiatry says that Georgia has only 8 psychiatrists per 100,000 children. The Academy suggests a better ratio is 47 per 1,000. It put Georgia last for the number of mental health professionals per capita. And so, what is actually inside that bill with the 7 sections? The first section covers the mental health parity provisions for private insurers. And so, some of that, what is that? Some of the examples, I can't go in all the detail because there's so much in this bill. It requires private insurers, non-ERISA, to provide mental health care coverage in accordance with the Federal Mental Health Parity and Addiction Equity Act. It requires mental health care coverage for children, adolescents, and adults. And it requires private insurers to submit an annual report to the insurance commissioner regarding comparative analysis and processes and strategies used to apply such benefits in the Federal Mental Health Parity and Addiction Equity Act. And so there's some more sections in here, but I want to go to section 1 through 3. It covers the Patient's Rights to Independent Review Act. And what those line items are is that it moves independent review panels from DCH to DOI. Section 1 through 4, mental health parity provisions for public insurers, Medicaid, Peach Care, and the state health plan also. And sections 1.5 to 1.7, it paralleled the insurance provisions for small group, large group, and individual insurance policies relating to coverage of treatment and mental disorders. Section 1 through 8, Medicaid appeals. Section 1 through 9 requires DCH to submit Medicaid, SPA, or waiver to CMS if necessary. And I know you guys, those of you about the CMS, it says that in the event that any of the changes in Part 1 of the bill requires a state plan amendment or waiver approved by CMS to implement, DCH is required to submit such SPA or waiver request to CMS. Part 2 of it is around the workforce and the system developments. So Section 2.1, Service Counselable Loan Program for Mental Health and Substance Abuse Professionals. Section 2.2 covers the Georgia Board of Healthcare Workforce. Section 3.1 of that covers assisted outpatient treatment. Section 3.2, involuntary commitment for mental health. And Section 3.3, involuntary commitment for mental health peace officers, transporters. So it has some details in there as it relates to when a peace officer is actually making that transfer. It's a lot more in here, but I wanted to talk more about the budget because I know you guys are hearing us talk about this bill. Says, okay, put your money where your mouth is. So we actually did do that. So for this year with 1013, the amount of money that went in to cover everything in this bill that I'm talking about, $14.3 million. The governor, the House, the state, the House and the Senate budget request was $143.4 million. So the grand total, when we talk about all the money that went into this year for the mental health, $153.7 million. And so, and it covers the agency, a lot of it covers the agency of the Department of Behavioral Health and Development Disabilities. And it is a ton of pages as it relates to the budget. I'll just go through some of them. It provides funds for a 10% increase for core services for addictive diseases at $1.6 million. Increased funds for Hope House to support addiction recovery, $1.8 million. Provide funds to increase salaries for state psychiatric hospital nurses and health aides to address agency recruitment and retention, $3.2 million. It provides funds for a 10% increase for core services for mental health, $6.1 million. Provide funds to allow for Medicaid reimbursement of psychiatric and behavioral health care management services, $1.1 million. Provide a one-time funds for a behavioral health provider rate study at $932 million. So it's a lot of dollars that actually went into that. And the bill the parity bill was the speaker's bill. So of course they wanted to get that passed, and of course we wanted them to pass it. If people could be excited about mental health every year, we can get some legislation passed. It would be great. As a matter of fact, this year there was a committee put together that is a mental health committee. So we now have a mental health committee right now in the House. So that's just how important it is to legislators. And we will continue to advocate for mental health. And just know you have someone here. And I look forward to hearing the questions, talking more about this bill, and just hearing what some of the individuals that are on this panel, what you guys think, because that, for me, that's what's important. What do you think that is a legislative policy that we should be pushing? That's what I'd like to hear, and I'd like to hear that from the public. And I know we talked about the Medicaid expansion. We definitely need that for substance abuse, for mental health, and we definitely need to still talk about that housing. That has not been addressed, and we definitely need to make sure that we're doing that. Even though we have this bill over here, we still need to do more.
Right. Thank you, Madam Rep. Very well stated opening comments. And again, you're a woman after my own heart, an advocate that is unswerving regarding mental health. We appreciate you as being our chair of our delegation, your leadership, as well as the others that are part of our delegation. And Douglas County has an awesome delegation on both sides. They play big, and we do appreciate you guys and being at the table. It's one thing to protest, it's another to put some on the table, which I've always believed in. Now, I want to hit something, Madam Rep. It's okay, so follow the map, y'all. $153 million, you go to jail. $153 million will get me to resurface every subdivision in my county. Or $153 million allows us to provide mental health services for those who are underserved primarily throughout the state. It's about trade-offs. There is equality, but then there's also equity, and it's also about how do we redistribute the dollar. And that's what it comes down to. So, duly noted, I know what you guys do. I know the decisions you have to make, and I agree with you, Madam Rep. When I saw this go down, I was like, oh, that's killer. I mean, every now and then when everything lines up, it's not about race, but about party. That legislation, you guys nailed it. I was like, no, they didn't. Yeah, insurers, y'all get behind this, man. Why are you going to use taxpayer dollars to sort of fund this and try to make up this shortfall?
Yeah.
Beautiful. Just like the other day with the fuel tax, with House Bill 170. Every now and then, that General Assembly gets it right. And this one, y'all got right, Madam Rep. So with that being said, I want to go ahead. Wendy, let's give Madam Rep her first question. Let's keep this show going.
Boy, Madam Rep, that bill is huge. I've only read abstracts from it, and as you were going over it, I was just floored at how much is in that bill. And I was very encouraged to hear that there's now a mental health committee that'll be looking at these issues at the state level. So with that in mind, I'm wondering, are there any other policies in queue for mental health that the committee is working on?
So I think for the committee getting established, and one of the people that established that committee was also one of the authors of this bill. And so I think just waiting and see how this is going to pan out. You know, every time we have legislation and we put these laws in perspective, there is always, you know, they come back and they add some additional things, they take away some additional things. So I'm really, I know that was the reason why this committee was established, so that they can monitor what is exactly in this bill and making sure that those things that are in the bill are actually happening. And especially with the data and analysis where you got to do all this collection now. So, and making sure that in all these areas that this bill is impacted, that there is some transparency to the public. So that committee will, they will be in effect for this bill, but not just this bill, any other legislation that anybody brings to the forefront and want to present will go through this committee.
Thank you for that response.
I think the big thing that we've always pushed, and I say we as the Democrats, have always pushed is Medicaid expansion. As I indicated, that will help tremendously for those individuals that do not have any insurance and want to get help with mental health or substance abuse.
Thank you, Madam Rep. I mean, great response. And again, the need is it's great. So, Dr. Allen, as you heard, Madam Rep said she wanted to make sure she hears from the public. So, if you can queue up a question after mine from the public, I greatly appreciate it. So, Madam Rep, as you, I mean, think about everything you just said in that bill. 76 pages long, and there's a lot of elements to it and a lot of benefits. Now, how is the average citizen going to even understand this? Now, I'm listening to you like, okay, it's going to take me a minute, guys. We're going to have to get a briefing on this. How does the average citizen access this or even know about this? Is there a communication channel or plan out there, or is it really on the locals for us to, hey, us to take what you have and now get that out? And I know, Ray Lightford, I'm sure you've got some words to say about this later as well, but I want you to think about that as well. So how do we get what you just said, Madam Rep, and translate it for the average person, not the elected guy, not the directors and staff, but the average citizens can take advantage of what was just passed by you guys into law?
So, if you really want to read the bill, even though it would be real difficult to understand, it's written by attorneys. You can go to www.legis.ga.gov. Now, if you want to get the talking points that I have around the bill that is pretty much explanatory in each section, I can make sure that I get that to you, Commissioner. And if you want to get that out to individuals that may be listening, that can email Commissioner Robinson, I can make sure you get that. Because it is a breakdown of actually each section, and it can tell you more in detail. And it's a little bit more in plain terms. It's not the legal terms that you will get actually in the bill.
Understood. And Madam Rep, absolutely. We'll do the heavy lifting for you. If you'll provide that to our office, we'll take it from there. Thank you so much. Dr. Allen, you've got a question for Madam Rep.
I'm ready.
Yes.
Hello, everyone. I'm Dr. Michelle Allen. Thank you, Representative Alexander. So one question is, citizens have seen police arrest people under 1013. So they're going to a hospital or a mental health facility. How does that factor into the bill?
So, I don't believe that is so much covered in here as it relates to that. There was some other legislation that came forth about, and that's something that I've always pushed whenever we've had our annual meetings with our commissioners and law enforcement. For me, we shouldn't really have to legislate this. I've just been really asking some of the law enforcement groups if they would. I think it would be important if we had a health professional on the force, that if there's any incidents that occur in the community as it relates to mental health, and it's just an incident that just occurred last night, I believe, that's in the news. The mother actually told the law enforcement that her son was having an episode. He was an African American male, to make sure that when you go out to the area, that you have someone that is knowledgeable of mental health. And the young man was shot and killed. So if there was a mental health professional with every law enforcement and they were able to handle those cases, I think that they would be more equipped to handle those cases than someone in law enforcement. And so even though we always pushing that you need to have training in this area, they are not the health professional. We still need to make sure that a health professional is on staff at all times with the law enforcement. And while they're handling what they're handling when it comes to the mental health, that we have someone that is a healthcare professional to handle that.
Okay. So I heard you say that the bill is looking for additional mental health, what do you call it? Professionals. So would that bill cover law enforcement hiring mental health professionals for the agency?
Right. So that's going to always be the question that, what do you say in your language? Do you say mandate? Do you say shall? So all of that is written up by attorneys, but I did see some language come through. I don't think it passed. It may have passed the House and got to the Senate, but it was basically talking about what I just said, that with law enforcement, that there should be a mental health professional with law enforcement. As I indicated, there are several pilot programs throughout the state where there are law enforcement officers that are already actually doing this. Um, so, I mean, that could very well be something that is drafted up next year and looked at. If it went through the House and then get past the Senate, then it may be additional things to do with that bill. It's just looking at that bill again and refiling it.
Thank you so much for that, Dr. Allen, for asking that question of the citizenry. Madam Rep, for your response. Wendy, we got one more question for Madam Rep as we make the turn of this show and keep it going. I know this, Madam Rep, you have so much information. You share it so easily with everyone, but we appreciate your efforts and your intelligence in this moment, because you really take complex things and translate them for the average citizen. So I don't want that to go unviewed, guys. That is a complex bill, and we look forward to your information, Madam Rep. Wendy, give her last question, please.
Sure. Madam Rep, can you tell us how citizens can advocate for policy change? What should a citizen do if they want to see more changes for mental health care?
Yeah, and it's not just mental health, it's anything. I would encourage you to know who your state reps are, know who your senators are in your district, know who the Congress people are too. You need to know that, if from a federal standpoint. But definitely for the state, if there's anything that you have for me in District 66, please reach out to me. But it helps to know your state legislators, so that if there is some legislation that you're thinking about, regardless of whether or not you're thinking that, does that sound good? Maybe can they do that? It's a good thing to just, what I always say, okay, draft up what you have so that I can get the idea, because everything that you're thinking about may not be what we can do. But I would say draft it up, and you draft that information and give it to us. And then, of course, I would ask more questions. I like to research before I actually just do my legislation, to make sure that, okay, I want to think it from the top to the bottom, from all the way, through that bill with okay, well, how is it going to affect these individuals? So I might reach out to another entity, just like the entity that I mentioned before, the behavioral health. I might reach out to them. I might reach out to public health. I might say, hey, how's this going to affect you? Because you have to know how it's going to affect those other entities. And so, the CSBs, how's it going to affect them? So just because you're thinking about that legislation, there would be several questions that I would ask you before we just actually start drafting it up. Once you give me the legislation, and if it is some legislation that we can draft up, it goes to an attorney, and then that attorney drafts up the language, and then it would be like communication back and forth on, is this what you're trying to do? So I think understanding what it is that you'd like to see done and what it is that we can do from a legislative and a policy standpoint. But I'm always looking and listening out from the citizens to what it is that they want to see. So they have an opportunity to reach out to your state legislators and your senators to see if we can get something drafted.
Great. Thank you so much, Madam Rep, for your participation in this 7th annual Mental Health Forum. We really do appreciate, again, your leadership. And you're going to hear some more shortly here as we make this turn. Time check to staff. How much time do we have left?
It's 7:30, Commissioner.
All right, thank you. So we're going to keep on moving here. Next up is Ray Lightford. Ray, we're going to have to keep it tight. You know how we roll, but I need you to go ahead and, Wendy, introduce our next speaker, please.
Yes, I am going to introduce Mr. Ray Lightford, but I want to make you aware that Dr. Tart has also joined us.
Thank you. Great.
Okay. So Mr. Monray Lightford had served as a leader within the Douglas County Community Service Board since 2015. In December of 2018, his leadership expanded from the Director of Outpatient Services to Chief Operations Officer. Mr. Lightford is a highly skilled public servant with a proven track record in the coordination of social services for individuals and households impacted by mental illness, substance abuse, and intellectual and developmental disability. His exceptional knowledge in nonprofit organizations, organizational development, and community outreach support his dedication to quality service delivery for all.
All right. With that being said, hold on just a minute. So, Director Lightford, Wendy, I want you to also introduce Dr. Aljuan Tart. We're going to run this parallel at this moment, please.
Oh, absolutely.
Y'all turn off your... Thank you.
So, Dr. Aljuan Tart is a Christian psychologist who utilizes his passion for improving relationships to provide professional relationship counseling services in Decatur, Georgia. He has served on the board of directors for the 100 Black Men of DeKalb, Forever Family, and the Gifted Education Foundation. Dr. Tart is a resident psychology expert for Radio 1 and serves frequently as a psychology expert for CNN, HLN, and other media outlets. He appears regularly on the Willie Moore Jr., Katie Bowe, Darlene McCoy, Ricky Smiley, and Cafe Mocha syndicated radio shows. His renowned experiences also include his practice as consulting psychologist for the Oklahoma City Thunder basketball team, as well as group facilitator for the National Basketball Association. He is a graduate of Morehouse College and is the youngest African American to gain a PhD in clinical psychology from the University of Michigan. He is a recipient of the NAACP Award for Lifetime Achievement in Empowering Youth and Families. Dr. Tart is a licensed and ordained minister who serves on the prayer team and as the chapel pastor for Word of Faith Family Cathedral Preschool and Elementary School.
Thank you so much for that, Wendy. So, welcome, gentlemen. Now we're going to get down to the issue. I've got Dr. Ray Lightford, who's going to serve as what I want to call the public voice. And then I've got Dr. Aljuan Tart, who's going to be the private side. And gentlemen, we need to get in here and talk about men. So everything that you frame has got to be from the perspective of the man. Dr. Tart, we already acknowledged that, as you know, you were one of the very first people back in 2015 for the general public. You was the first person to help me kick this off, having this mental health forum. So Dr. Tart, I also welcome you back. But this is supposed to be a conversation, I think, again, having addressed women, veterans, children's, relationships, family. I think it's time that we dealt with the men. And so let's have this conversation here. So Ram, I'll let you start off and get your 5 minutes in about sort of the services you provide with the flavor of men. Dr. Tart, you'll come after that, and then we're going to go a deep dive in some questions and some Q&A and see if we can get somewhere here. So Dr. Lightford, go ahead. Go ahead first, sir.
All right, well, thank you. I just want to give a little bit of information to the community. So right now, the CSB serves about 7,652 citizens. Out of that, the median age range that we service, the majority is between the ages of 30 and 65. These are your working class people. These are your everyday neighbors. In those numbers, 254 consider themselves divorced, 363 are married. Then we have 113 that are separate. In those numbers, we also provide stable housing for about 170 individuals, but we still have over 700 youth that identify as homeless in this community that are not in that number. As we continue to grow and work toward the stigmas that are impacting us as a community, we reach out constantly to community partners to find new and creative ways of trying to meet people where they are. Some of the factors that we like to take pride in and we focus on are those things that create the imbalance. We like to focus on not only the psychiatric need, but the employment needs, the camaraderie needs, the housing supports, the economic stability, all of those factors that can lead to a mental health crisis.
I appreciate that. So you came from obviously a public perspective. Dr. Tart, why don't you take over now and introduce your practice and what you see from your perspective?
We see men utilizing mental health services at a record clip. What's happening with the pandemic is that work stress, life stress is causing marital stress, causing relationship stress. And for the first time, we're seeing the typical client coming in for counseling being Black men, people who have traditionally said they didn't need counseling, now realizing and seeing a need for it. So as the stress from the pandemic and stress from an upcoming recession stress from, like Representative said, from the Buffalo shooting, things that are happening that are affecting people. We now see men utilizing mental health services, which is causing almost every single mental health professional to be booked. So there is a need for more mental health professionals. There's a need for more counselors. There's a need for more social workers within every area. So whether that is psychology, whether that is social work, whether that is within ministry, whether that is within life coaches that are trained to listen, we need all hands on deck because we're having to turn away the clients we've been begging for, right? So the most high risk, most resistant, we're having to turn them away because simply it's not enough capacity. So I'm glad that it's there, and I'm glad that we're able to expand and be able to meet the needs of men and their families.
Thank you, Dr. Carr. I mean, you bring up a good point about capacity, right? I mean, how do we absorb it? But is there a difference between the private sector, which is, as you heard Dr. Harris say earlier, that there's a place of privilege that she could access, she could be accessed, and she could access certain services in the community, so there's that, the haves and the have-nots, right? And so I'm trying to make sure that, okay, is there a difference? In other words, whether I have or have not, you're seeing an equal access to the system. So, Director of Lightford, won't you piggyback on that? What are you seeing? Because he's saying it's an increase in men having access, which I'm delighted to hear. But, sir, weigh in.
Absolutely, there's a difference between the private sector and the public sector. You're not fighting with everyone. We don't turn anyone away. So, with that being said, if you are insured, if you're not insured, you come through the doors first come, first serve. Where when you're in the private sector, there's either a type of compensation or insurance package that you're utilizing, or it's a certain dollar amount that's going to get you access to that a lot quicker. And so when you look at it, think about having access for 140,000 people versus having access for 5,000 people. That's your difference. And so we need to start to focus on putting revenues directly in the community. Anyone will tell you, National Council on Behavioral Health said, in order to impact effective change, things have to be done at the community level. You can have a lot of legislation, you can have a lot of things that are coming from the state, but if there's not community initiatives based on the population's needs that are in that local municipality, it won't be sufficient.
I got you. Thank you for that. Wendy, let's give Dr. Tartt the first question. Can you field with him, and Ray come behind that, and Dr. Allen, get ready for your set, please.
Yes, sir. Dr. Tartt, can you tell us, you just said that you are finally getting the clients that you were begging for, but now, capacity is an issue. But if men are those less likely to seek mental health care, could you tell us why?
Well, I think before we thought that seeking counseling meant that we were weak. We thought that saying, okay, I can't handle it was a sign of weakness. But with the new PSA and mental health now coming to the forefront, and the campaign of it's okay to not be okay, and seeing so many high-level suicides involving men. Men are more likely to commit suicide than women. It's not even close. Men are coming to grips with, hey, I'm stressed, and it is affecting my mental health. It's affecting my job security. It's affecting my marriage. It's affecting my relationship with my children. It's affecting my health. We're getting a record number of referrals from primary care physicians who are saying, hey, this is stress-induced. And so now men seeing other men, on PSAs in real life, saying that they get counseling. Men are coming in record numbers because their capacity to handle it is beyond what they could handle. Before, okay, I can handle it. Now, men are like, no, this is too much. I'm not sleeping. I have an ulcer. Arguing with my wife. I have to figure out what to do with my job. I might be a manager at work, and the people that who I manage are more stressed, so I'm coming home with more. So men are now utilizing it as a tool and realizing that the manliest thing they can do is actually disclose what they're going through versus keep it closed up and getting sick and hurting those we're supposed to protect and provide for.
I appreciate that response. Absolutely. So there's insecurity out there, there's inadequacy, there's inferiority, and all all this is being amplified right now. But what I'm hearing you say is that, but it's okay. I mean, of course. I mean, think about me. I've had to evolve through going blind. I hear y'all talking about shelter in place. I've been shelter in place for 8 years. Get it? Like you gotta evolve, and that's a tough one. But there is something liberating about having access to people to share with, to begin to sort of deal with a reality that that life is not the way I thought it was going to be, or you, like you said, something impacts you, hits you, and it alters your life. So duly noted, but you do need support for it because it is a different way of thinking. Wendy, let's keep this going. Let's give a question now to Director Lightford, please.
Yeah, something that you said was very interesting to me. I believe you said that you don't turn people away. The CSB doesn't turn people away. Is that right?
That's correct. We are what the state calls a Tier 1 comprehensive provider under contract with the Department of Behavioral Health and Developmental Disabilities that Representative Alexander was speaking about. And so in that contract, anyone that walks through our doors, no matter their age, we have to see, regardless of their ability to pay for the service or not. And so that's how we operate. Now, the only time that we may have an issue is if someone comes in our doors that may have an intellectual disability that makes it hard for us to figure out what that need is. Now, we may have to refer them outside to an additional source, such as the Marcus Autism Center or something like that. But we normally try to screen every person that comes through the door.
So as the need for mental health services has increased over these past 2 years, has your capacity to serve people increased?
Yes and no. We grew with the need. We grew with the need, but the need continued to grow. When we initially started this off in 2018, we had a staff of 15 mental health professionals. Today we have 44, and we still have a 3.5-week waiting list on most cases.
And I appreciate that response, but as you know, though you're a semi-autonomous separate authority as a service provider at the local level, the Board of Commissioners does provide funding. This is key. We spend less than, I think the last time I saw at the end of last year, less than 3% on our entire budget on DFACS, seniors, community service board, and I forgot the last one. Think about it. Less than 3% of our budget, but we spend an awful lot more money in public safety. We get it. We all want to be safe, so nobody's, that's not the argument of the night. We're just saying that our commitment to the community service board is that we increase that over time, and we know it's still not enough. We want to get it up to maybe 6% or 7% of our overall budget. We probably get a better yield over time by doing that, by reallocating resources accordingly as we grow, not to replace, not to cancel commitments to public safety, but at the same point, there is growth and you just have to redistribute. Dr. Allen, you've got a set of questions for Dr. Tart. I think that would be appropriate.
Yes, sir, I do. Hi, Dr. Tart. I'm Dr. Allen. My main question is, hi, thank you for coming here and sitting in your car. We appreciate it.
Reading is fundamental.
I understand. So what generation are you seeing most of? I think Generation Z is more so willing to have, to come see you. So what generation do you see mostly?
I'm seeing all of them now.
Uh-oh.
Yeah, I'm seeing all of them, right? So Gen Z, I mean, they grew up watching TV where there's a therapist on every single show, right? Well, where they have mental health professionals come in and talk to them. So I'm seeing a lot of children. I'll tell you the piece, I'm seeing a lot of children who sheltered in too long. So they've gotten used to virtual, and I know parents are shaking their head watching this. So kids have been on social media, but they've lost contact. So they're delayed 2-3 years. So you have a third grader that's been on TikTok, that is on social media watching Disney Plus. And now that birthdays are happening, they don't want to go to the birthday party. So they're having anxiety about going to birthday parties. We're having teen girls, self-esteem and suicide rate skyrocketing, right? Why? Because the social comparison on social media has led all teen girls to feel less about themselves. Matter of fact, it's so bad, they're saying if you want your teen girl to be happier, take her off of social media, limit the time, because what's happening is the more time teens, especially teen girls, are spending on social media, the lower their self-esteem is. And the reason for that is, one, there's social comparison. Everyone's using filters. The average kid uses filters to make themselves look perfect. and they're not connecting with other girlfriends. So they're spending time online, and while it's entertaining, it's not the main thing, which is relationship, which is what girls need. Now, contrast that to boys. Boys are doing better. Why? When they were gaming, they were talking to their friends. So they were playing games and still interacting socially, while teen girls were tending to isolate and spend their time on Snapchat and TikTok and Instagram instead of connecting and having girlfriend time. So that's the biggest issue that we're seeing with Gen Z.
Okay, so I understand. So Douglas County, you need to get your girls off of social media. And so my next question is, do you think that the stigma is decreasing with Black men coming in to see you, or do you think it's gone?
It's not gone, but it is certainly not what it was. Like, men now realize, why would I contaminate my family with my stress? Right? And I'm using that word on purpose. I want people to think cancer. All right? If you're stressed and you have stage 1 cancer, would you let it metastasize? So men realize, I have stage 1, stage 2 stress. You've had to bury your mom. You've had to participate in a number of weddings. I mean, not a number of weddings, but a number of funerals. Work is now, a recession is coming. So your income is not where it are. Your funds are not there. Kids are at home while you're trying to work, right? All these things. Your wife is, you love your wife, but y'all working together with the kids on social media. You need those work trips. I need to miss you, right? How am I supposed to concentrate? Anyway, so what's happening is that there's a lot of stress. So men are coming in and saying, you know what? At the end of the day, if I'm well, I can show up as a better husband or a boyfriend, a better father, a better business owner, a better pastor, a better commissioner, right? And so they're coming in because, and what it's doing is it is positively affecting our family. So more and more men are coming in, and I'll tell you the second reason, because their wives, sisters, daughters are making them, saying, no more drinking, no more alcohol, no more infidelity. You need to go address this the right way. And men are listening, seeing athletes on TV, seeing celebrities. Okay, so if the chief of police is going to get this, is going to talk about stress, and then I'm going to go. Right. And so the more men that open up about going, the more men feel comfortable, and obviously, and also seeing more men whom they can talk to. Although people will be surprised that a lot of men prefer to talk to women because they're used to having intimate conversations with women more so than men, just due to the dynamics of our community. So it's not necessarily it doesn't necessarily mean that we have to increase the number of male providers, which is needed, but just providers who are comfortable speaking to Black men. And surprisingly, a lot of times it's women.
I'm telling you, I thought the absolute opposite. I thought the men would want to talk to other men that they may have something in common with, like in a group session. But I see I'm wrong. Thank you so much.
Well, we don't want to unmask. We don't want to unmask sometimes. To another man, sometimes will say, well, he judged me. But if I'm, and then a lot of times men have not had access to a dad. So to sit down and have wise counsel with someone who's familiar, or maybe but you're used to your wife, you're used to your mama, right? You're used to that teacher, right? So there are a lot of men who are who are open to going to counseling. They're just looking for someone who feels comfortable working with men and does not judge.
Thank you both for that interaction and stuff. So I'm going to keep this in because I know we're coming toward the end of this. So I just want to also acknowledge that, again, while this is mostly focused on preventative, and we know there's a whole holistic model approaching mental health, which we're probably only doing 2 out of multiple modules. It's where we are. But I do want to acknowledge our judicial system in Douglas County, led by Chief Judge Bo McLean, and their efforts over there with the accountability courts. We had an awesome presentation, so I would encourage the public to go look at Monday's work session, in which they did a fantastic job of showing how they deal with, on that side of mental health. And, you want to go to jail, you want to go home, and the programs that you can go through regarding that. Let me swing back to you, Ray. So on that side, so while I hear the relationships, I hear the family, I hear the houses, I'm sure you see the other side of that equation, like give balance to this conversation, because everybody's not married, everybody's not in a relationship, and there's a need for all types of things. But can you give another side to this, please?
Well, sure. I think that when it comes down to who individuals comfortable with saying to, a lot of it has the cultural background. You know, we will find out oftentimes some of our sub-Saharan brothers want to talk to a male because they don't want to open up to a woman. But like I said, young man that grew up without a father figure, he's going to cling toward having more of that woman to be able to look up to, because that's who he's got his advice from his whole life. Also, when you're dealing with children, what we've learned is now there's a whole new environment where they talk about peer or young adults that had went through the process that some of these kids are going through are some of the best outlets. So you'll hear a lot of things talking about peer supports happening now in the community. Some of the old traditional ways that we used to think about things are gone. We used to say, okay, well, you're unemployed, you're underemployed. Let's go ahead and get you with a social worker. Well, it's not working with that now. Now you're working with an employment specialist because you get to pick what type of employment you want. And so you're doing a job profile. All these things fall into behavioral health. And I think oftentimes we bottleneck it with these stigmas. We think somebody has low IQ because they have a mental health diagnosis. Mm-hmm. We think somebody is not as articulate or as versed as most people we deal with. But the people that we service are our neighbors every single day. It is you and I. And that's what I would like for the community to know. It is no foreign object that's out here that we're just poking ourselves with. It is everyday people that go through these crises, some short-term, some long-term.
All right, so then I'm almost there, and I'm going both Dr. Allen and Wendy, please prepare your final questions for our two speakers. But gentlemen, here's where we are. So here I am as an individual, and I'm going to go in both you guys' respective places. My question is, what do I ask? I mean, right now, if there's somebody out there that's watching this, and we're talking about it, but I'm like, it's like ministry. Get down to it, guys. What do I say if I walk in you guys' door? What do you say to me? How do I? What is the process of change? Because we're talking about it like removed, like it's an object, like it's an avatar. It's like, okay, y'all make this. Can y'all break this down, both of you, in such a way that if there's someone out there, especially a male, since that's this year's focus, that I've got this epiphany, like, okay, I know I got issues. Now what? And there's no right or wrong, but I just need you guys to guide the people in that's watching this, please. Yeah. Dr. Tom, take that first one, then we'll come back to you, right?
Okay.
All right. So there's a process. So how does counseling work? I'll be brief. It does three things. Self-disclosure. So it allows you to disclose what's inside and let it out. What you let out, you can control. What you keep in controls you. So the first step is self-disclosure. So instead of keeping childhood trauma inside, you let it out where you can disclose it, and that way you can relive it and then release it. All right. Number two, self-compassion. So you're able to actually open up, and there's a trained professional, like Ray said, that you choose, or someone that's specific for you, that shows compassion to what you've been through. So it is automatic support. So you're able to talk about how you feel and get empathy and feel warmth and have caring, and also get rid of your own self-criticism and show compassion to yourself for going through childhood trauma or adult trauma or whatever you're going through. So there's no judgment, just someone who's able to normalize so that you can neutralize. And then the last one, self-distance. Distancing. You're able to get distance from the trauma, from the stressor, and that's why you see two people who go through things. One talks about it in the past, and the other one as if it's still going on. All right, I see Ray shaking his head. So when we get men and women, children talking about it, they're able to process their traumas by getting distance from it, right? With space, time, and language. Space, looking at it from a third party. Time, being able to say, in 3 years, will I care about this divorce? No, I won't, because I'll be able to learn and be with someone I could be happy with. And then finally, different language and say, hey, you went through a stressful period. You are not you're not a problem. You went through a problematic period. So you're able to distance yourself from what happened to you and be well. That's what counseling does.
I appreciate that. So what I got, disclose, self-disclosure. The last one was distance. What was the second one again?
Self-compassion.
Self-compassion. Got it. We make sure we capture those three notes. Ray, bring us back home the other way, man. Weigh in on this right here.
Oh, well, I'm loving it. Dr. Tart hit everything on point. I'm going to throw in one disclaimer, just personal experience. Once all these tools have been put in you, make sure that you bring that trigger or you separate yourself from that trigger. Either they got to be part of the healing process or they've got to move out. Because it's great for me to give you all these tools, but then you go right back into that same environment that's constantly triggering you over and over again, whether it be a bad relationship, whether it be a nagging mother, whatever it may be. So you've got to make sure that people are on the journey for your healing process with you that want to see you win.
Gotcha. Thank you so much. Dr. Allen, give Dr. Tar his final question, and when you prepare to give Director Lightford his, please.
Yes, sir. Actually, I have one question that I'd like both of them to answer, and that is, are there any groups just for men, and how can women help their men to counseling if they need it? I see you laughing.
I'll take how women can help men. All right. Instead of asking men to go to counseling, don't say that. Don't say, do you need help? Don't say something's wrong with you. No, instead say, baby, on a scale of 1 to 10, how happy are you? This is called motivational interviewing. A man's going to open up and say a 3, 4. All right, baby, what's working? This part is working. Work is working. All right, and then what would make you happier? What would make me happier if I could find another job, if I could lose weight, if I get rid of this diabetes, and if I could have a better relationship with my daughter? Okay, all right. Baby, how do you feel about working with a coach? Don't say counselor. How you feel about working with a life coach? Because men are used to working with coaches, athletic, business. Talking to a coach or a professional to be able to help you move from a 3 to a 9. Baby, I'd love to assist with that. And what we know is that most women make appointments for their husbands. For whatever reason, all right, baby, you can work through the insurance maze, right? If you can find a provider that you know I like, men will go when women set up the appointments. Now, that's not just mental health, but that's also physical health. So ask him through motivational interviewing. You'd be surprised that if you ask a man how he's doing, he's going to say fine. But if you ask on a scale of 1 to 10, he'll say, actually, I'm a 3 since you asked.
No, thank you for that. We got to stay on time. So Director Lightford, come on in, weigh in and respond to her, and then Wendy, come behind him, please.
Gotcha. So my question was about support groups. Well, there are thousands of support groups, but what I would really emphasize on is making sure that person gets that individualized care first. Because what you don't want them to do is go into a group setting and he's triggering everyone else. And so first off, let them have time to identify that something's going on, seek appropriate treatment for themselves, and then let them start to find and identify environments in which they're comfortable expressing what's going on. There are guys that do group trips all the time, golf trips, guys that play poker every Thursday night. I mean, everything doesn't have to be in a clinical setting if you find the right support group. So we talk about natural support systems. They are very key to the successful recovery. You've got to have those types of people that are around you that give you that positivity, that feed into you, and not just suck out. And so I would go there first, get individual help, and then start to really identify those people that are important in your life and start to spend more time with them because of what they put into you and not take out of it.
Very good. Thank you so much for that. Wendy?
Yes, sir. I have the same question for both of you as well. Director Lightford, you just mentioned finding those support systems. And, as we get older, it's harder to make friends. It's not the same as when we were younger. So finding that support, and I won't even bring up COVID, right? Finding that support in our ever-increasing digital society is a challenge. So do you have any suggestions or tips on how men specifically can go about finding those supportive relationships?
Absolutely. The first thing they do is that everything can't revolve around the house and the job. Get up, go jog, go run. You'll never know who you'll bump into one. Take the grocery list from your wife. Say, I'm going to go to the grocery store today. Find different environments to where you're going to meet new people. You'll never know who has a common interest if you stay inside these secluded walls, these little safe havens. So that's the biggest thing, is that you have to change your routine. And that's what's hard with us. We get into a certain routine. Everybody looks forward to Friday so they can stay up late and then sleep in late on Saturday. It's the same thing over and over again. Take and find time to get out and meet new people and just start random conversations sometimes. You'll be surprised. but you have to get out of your own way. And that's what we do most of the time. And then we wonder why we're depressed. We don't do anything.
Very good. All right.
Director Lightford is right on it. All right, I'll just be brief. Because what he's talking about is being pro-social. That means intentionally making friends. Everyone knows about Commissioner Robinson. You're going to walk in the room, you're going to talk. You're going to learn your life history. He's going to work the room. All right? Why? That's why he has so many friends. That's what we have to do. And so join affinity groups. So exercise, but exercise in a group. Men's ministry. Men's ministry is a lot of fun, right? Joining CrossFit, kickboxing, going to Taco Mat and watching your favorite team, finding out where your favorite team is watching the game and then connecting with other people. If you're in a frat, whatever it is, doing things to collectively be around your tribe and then speaking first. We are in the middle of a loneliness pandemic. And so chances are the person you're speaking to is just as interested in hanging out with you as you are in hanging out with them. So I agree with Director Lightford in changing up your routine and being intentionally social, using social media to link up, and then doing life off of your phone.
Gentlemen, thank you so much for the contribution during today's Mental Health Forum, our 7th annual. This was some good information. I'm going to give you guys both a closing statement because this is where it came down to. This was the purpose, this right here. So if you had anything to say beyond quick tips and all that, what would you say to the men right now, gentlemen? I'll start with you, Dr. Tart, and of course, Director Lightford, you can bring us home. Last closing comments.
Yeah, I'd say, one, let's support mental health initiatives. You talked about public safety. Mental health is public safety. Just this week, someone was murdered at Fogo de Chao here in Atlanta. He was a psychiatric patient, according to the parents, that should have been inpatient. When we increase funding to hospitals, which has been cut, Georgia is 49th, 50th, when it comes to mental health funding. And then Director Lightford has to figure it out and be creative. And it sounds like he's doing a phenomenal job. If we're really serious about public safety, we're really serious about saving marriages and decreasing depression, it is absolutely putting our money to meet the demand. You heard Director Lightford said 3.5 week wait list. What if men could come in, women could come in and be seen that day, that week? Because there are a lot of people that don't show up because now they felt like they weren't served when they needed it. So increased mental health funding now helps save and helps support public safety.
Thank you. Director, bring us home.
All right, I'm going to bring you home with 2 small quotes. One is the one thing that you can always spend but never gain is time. And the last thing I want to give you for somebody out there that right now may not think there's hope, life always offers you a second chance, and it's called today. Do something today. That's all I have.
I appreciate that. Well done, gentlemen. Well done. To the citizens of Douglas County, I want to say thank you for tuning in. I must give special thanks to Tiffany Stewart Stanley. She's our Assistant County Administrator who always provides an eagle's eye watch over everything regarding the Board of Commissioners. And Madam ACA, thank you for making sure this show turned out. To the communications group, thank you guys. You came through very well. To my co-moderators, Wendy Cottle and Dr. Michelle Allen, thank you both for being here. Wendy, we're going to appreciate you now that you're moving on to your new assignment. I look for you to do well on behalf of the whole county and not just obviously District 2. So congratulations and best wishes in your new assignment. And Dr. Allen, I appreciate you because you're now going to own mental health going forward. This is going to be a beautiful transition. So I thank you both for being involved in Douglas County. With that being said, this has been an incredible evening. I think we got to the issue. We started with Dr. Patrice Harris. Wow, what a level of conversation we had. Then we had State Representative Kimberly Alexander to break down House Bill 1093. Then we had our 2 colleagues here from men's issues. And it was a lot that we could have covered during this period of time, but it was one of those where I really believe that we did what we need to do to move things forward till next time. So with that being said, I won't belabor it, though I know I can go on. Not tonight. I'm tired. With that being said, I need to go and decompress myself. So ladies and gentlemen, thank you for tuning in to the 7th Annual Mental Health Forum hosted by Vice Chairman Kelly Robinson. Thank you all. Good night.